The nutrition situation in Nigeria is, in northern Nigeria, it's not quite an exciting one, it's not an encouraging one. Overall, the nutrition situation in Nigeria as a whole is on the high side, and it's worse in northern Nigeria. The stunting level is as high as 63% in some parts of northern Nigeria, with an average of about maybe 45%. The national average is 37%, from the 2013 Demographic Health Survey. Wasting level can get as high as 30% in northern Nigeria. National average is 18%. And the underweight is equally very high in northern Nigeria, whereas the national average is 29%, can get as high as 35% in northern Nigeria. So overall, the situation is worse in northern Nigeria than in the other part of the country. My role as the head of Scaling Up Nutrition Movement in Nigeria involves coordination of nutrition activities around scaling up, working with partners and all stakeholders who are committed to scaling up, to the Scaling Up Nutrition Movement. I coordinate the various networks, the donor network, the business network, and the civil society network, as well as the government side of the Scaling Up Nutrition Movement. As a focal person for nutrition in Nigeria, I bring everybody together around a common objective and goal. The major challenge today for organizing nutrition, tackling malnutrition in northern Nigeria today is that of security. We are constantly faced with the security issues in northern Nigeria. But beyond that, coming down to other challenges, we're talking about the major determinants: health care practices, poverty, and non-availability of basic amenities. And I think there's also the problem of the lack of the adequate nutritional knowledge, and the cultural practices of the people will tend to affect what they eat, how they eat, and the likes. These are some of the challenges. But in terms of organizing around scaling up nutrition, it has to do with everybody wanting to do something in northern Nigeria, and it relates to that of coordinating the activities of all the partners. And of course, you cannot rule out the challenge of funding. We're trying as much as possible now to leverage public funding for nutrition, as against what it has been, which has been that of largely donor-driven funding for nutrition in northern Nigeria. The Scaling Up Nutrition movement brought together partners rallying around common objective. That was a great opportunity, and that has also seen many donors coming in to support nutrition, nutrition activities, both the direct and nutrition sensitive and nutrition specific interventions. The movement has also brought about the awareness, bringing up the awareness and the importance of nutrition as a development issue, and drawing attention to the fact that if we have to attain the Millennium Development Goals as a nation, then we need to begin to pay attention to scaling up nutrition. Well, we have seen increased resources for nutrition. We've seen increased public policymakers increased interest and awareness for nutrition. We have seen, in this short time, we've been able to review the policies. We have a costed strategic plan of action. developed and everybody rallying around that same plan. We've been able to set goals and targets. We've reviewed guidelines. What is left right now is for us to now begin to scale up. And in this short time too, we have successfully, at least we now have a funded budget line for nutrition in the Federal Ministry of Health. We've seen nutrition being mainstreamed into other sectors, particularly the agricultural sector. And we're seeing changes in other Nigeria as well in the area of social security. We have conditional cash transfer programs by some of our donors, and government too, with increase in the within Maternal, Newborn and Child Health Week as a program that tries to deliver high-impact interventions, some of which are nutrition interventions, like vitamin A supplementation, deworming, iron and folic acid supplementation for women, and then nutritional screening for children under the age of 5. I hope to see government funding becoming catalytic for increased funding for nutrition. I want to see partners, stakeholders rallying around the strategic plan which has been costed, so that we can work towards achieving the set goals. The goal which include increasing exclusive breastfeeding rate up to 50%, reducing stunting to 20% of the present rate, ensuring that there's no increase in overweight, reducing anemia in women by 50%, and those other targets that have been set out in the strategic plan.